So in trying to diagnose or in trying to know the stage at which an acute kidney injury is at, there's one criteria that we actually still use to actually, this will help us know the extent at which the acute kidney injuries has actually affected the patient. So this is what is known as the rifle criteria. Okay, so rifle, being a word, is actually an abbreviation. R stands for risk, I stands for injury, F stands for failure, right? L stands for loss, then E stands for end-stage kidney disease. You understand? So this criteria was actually introduced in 2004, and this is like a summary of it, summary of the AKI. This is rifle, this is AKI, right? So for the rifle, focusing on it, this is how we can be able to actually access, the extent at which kidney injury has actually progressed. So if it is at risk, you are saying the serum creatinine is increasing by 1.5, all right, and the glomerular filtration rate is decreasing, all right, by at least 25% or more than 25%. Okay, so this is the serum creatinine criteria. There's also the urine output criteria. Okay, but let's deal with the serum creatinine criteria first. If it is now at the level of injury, it shows you that the serum creatinine is actually increasing by 2 times, and the glomerular filtration rate is decreasing by 50%. Okay, failure is when it's increasing by 3 times, glomerular filtration rate is decreasing by 75%. Okay, loss, this is when it is now persistent for more than 4 weeks. Somebody is having these issues for more than 4 weeks. Then end stage, this is when it has gotten to 3 months. That month is no longer acute, it is now chronic. Okay, so we also have the criteria, and this is based on the amount of urine that the person is producing. You can pause to actually observe that. So key insight is a draw criteria. It looks at the serum creatinine levels and also the urine output levels. Do you understand? So this will help you make better diagnosis. All right, so progress matters. So moves from risk to injury to failure, to loss to end stage. So helps you know the likelihood of a patient recovering from a condition and all. So limitation, it requires baseline creatinine. So when a patient comes, you must actually measure the creatinine as at the time you are meeting the patient the first time. So this will serve as your baseline. Once you miss that out, then it's very hard to actually get through. All right, so urine outputs can be affected by diuretics. So can be affected by the drugs that the patient is taking and all of that. So you have to be careful. All right, so but by and large, that's just what the rifle criteria is. So you can do me a favor by pausing here to look at the rifle criteria, then also the AKI criteria. These two serve as a way of trying to classify or stage acute kidney injury.